right, well, let's get started. We'll get this presentation going a little bit, go over our agenda as we always do. So we're gonna go talk about the intro, talk a little bit about Revive, of course, tell you what our amazing giveaways are today. You get to meet our experts, and then we're gonna do our live treatment with Lotus right back here. And then just go a little bit over CoolSculpting 101. So give you the basics, and then of course, how to get in touch with us, and then a live Q&A. All right, so everyone, a little bit about Revive Med Spa. I think some stuff has changed since we last did this because we now have 10 locations, everybody. This is pretty cool. So we are all over California. We're the #1 provider of CoolSculpting in California. I think a big thanks to Michelle. She probably has seen about half of California. We're also the #1 provider of Botox, Juvederm, Voluma, Velour, Volbella, Kybella, Latisse, and Skin Medica in California since 2006. So we actually just had our 18-year anniversary when we opened our first location. Cheers to that. So pretty cool. We are here. A little bit about our medical team. We have all of our staff, of course, is very dedicated to helping you look, feel your best. We have our medical directors and co-founders on the boards here. So Dr. Leaf Rogers, Dr. Verma, and Dr. Rappaport. So they're amazing. They're constantly and consistently providing advanced training opportunities to all of our providers. And we always have the access to the latest and greatest technologies and techniques. So that's why we just continue to love seeing all of your faces.
How lucky are we?
I know.
We have the most amazing medical staff.
We work with the best. We really do.
Yeah.
Awesome. So Michelle, and speaking of the best, here she is. Michelle, do you want to tell everyone a little bit about yourself?
Well, you guys know I'm Michelle. Love CoolSculpting. I've been CoolSculpting here for probably about 8+ years. I love everything about CoolSculpting. It's just, at this stage, everybody has just that little area of subcutaneous fat that we all just want to take care of. And when I started CoolSculpting, it was, oh my God, you can do this. You can lose that subcutaneous fat. So that's why I got into CoolSculpting. And, I went through the CoolSculpting University master's program. Allergan is amazing. They train everybody so well. And I love everything about CoolSculpting. The results are the best. I think I'm more excited when people come in and I see their results and I see how happy they are. And, we all want to look our best. We all want to feel good. We want to feel good in our clothes. And so why not? It's just, I tell my clients, it's like going and doing a little Pilates class and just that extra little help.
That's awesome. Yay. And yes, I'm Liz. If you guys don't know me, I know a lot of you have seen me before, so I love seeing you all again. All right, so Michelle, do you want to kind of start off with just what is CoolSculpting?
CoolSculpting is a non-invasive, non-surgical treatment, and requires little to no downtime. It's really nice because it's non-invasive. It's you just come in, you have your CoolSculpting done, and you can go back to work. You can work out. It's based on cold, and we'll go into that because we have Desiree here to explain everything to you guys. Again, let me just tell you, it's FDA cleared. We have 9 areas of the body, which is amazing. So we have all those tiny little areas that you can't get rid of. CoolSculpting will work for you.
Yes, I think everyone has those stubborn areas.
Oh,
like,
yeah.
Why is this
and
here?
9 areas, like 9 areas, that's a lot. And it's like, a lot of people will go, can you do your chin? Can you do your little areas that when you're, when you're working out, you have those little peaked areas when you're wearing that bra. That area is a great area. It's like your little bra fat. You can do underneath the chin, just like your jawline, your back fat, which, like on that back area, abdomen, all 4 areas of your abdomen. And what a great area is too, is like right underneath that bra line. That area, that little areas that peek out, from the fat. And I always kind of blame like our bras that pushes it down.
Yes.
You have your outer thighs, your inner thighs. You have underneath we say underneath the buttocks, and we call it the little banana roll, which we still don't know why it's called a banana roll.
Better, I guess, right?
And then the great thing is you can do your arms as well. And the arms are amazing to do. And, they came out with that. We were so excited. So that's a nice little area when you kind of that little flap in your underarm. That's a great area to do.
Yep. And Lori, hopefully that answered your question. Yes, I
Oh,
mean, inner,
yeah.
outer thighs, underneath
Yeah.
the buttocks, yes.
Yeah,
Yes.
and you know, yeah, Lori was asking about what about the saddlebags, and that is your outer thigh area. It's a really, really nice area to take care of.
Perfect. Yeah, and you bet. Thank you.
Thanks, Lori.
Awesome. So obviously,
Yeah.
everybody, we all have fat cells, right?
Mhm.
So tell like a little bit
Yeah.
about this process.
Yeah, well, with your fat cells, when you eat your food, it just travels through your digestive system and then to your liver. The processed fat is, that's what stores your energy in your body. And then the excess fat is stored in your body in your fat cells. And we can have can we have Desiree pop in?
Absolutely.
And Desiree is going to she's amazing at the science part of it. And I'm going to hook up Lotus. She's ready, and we just kind of want to explain. I kind of started Lotus ahead of time, so we're doing her whole abdomen area. So we're gonna do the other two sides, and we're gonna dual sculpt that. And so while Desiree's giving you a little bit of the science, I'll just get Lotus ready.
Awesome, and I'll zoom in as well too. You can go to the next slide here. I know we want let's introduce Desiree first. Desiree, hello. She's
Hi.
fabulous.
Hi, everyone.
Tell everybody a little about yourself and why you're so great to explain this.
My name is Desiree Callahan. I am the practice development manager with Revive and CoolSculpting. I've been with CoolSculpting for over 7 years, and I've been in the aesthetic industry for over 20 years. So, I'm really, really passionate about this technology. And, Revive is really the best of the best. They have the best providers here. They have the best technology. And so I'm really excited to share a little bit more about what this treatment entails.
Amazing. Yeah, so we're gonna, I'm gonna zoom in for everybody to see here as Michelle gets the pad put on, the gel pad, and then you can kind of see the machine, how it like suction cups it in, and we'll get it started. So I'm gonna pop out, but here we go.
So you guys, this is Lotus. She's amazing. And she came into me, and her whole part was her abdomen, her upper abdomen and her lower abdomen, and that's what she wanted to cool sculpt. Lotus is getting ready for summer because I heard she's off on a little vacation. So Lotus, where are you off to?
We're going to Hawaii for a couple of weeks.
Nice. So basically, this was just your little area, and I know that you exercise and that and the great thing is you don't have to exercise when you pull sculpt. The nice thing is if you walk or take a hike, that's great, and then the other people that like exercising, fabulous. Exercise, diet, and pull sculpting all together is absolutely amazing. So we're always protecting the skin. So I'm just wiped down the skin. And then we're just gonna put a gel pad on. And Desiree, what does the gel pad do for us?
So I'll come back in the screen off to the
Yeah.
side. So the gel pad is going to provide a protective layer against your tissue. With this technology, with the combination of the freezing temperature and the vacuum, we're able to just hone in on the fat cells and not affect any of the organs or the tissue. So this is just another layer of protection, and it's going to insulate your skin to protect it from getting frozen.
So it's a little sticky and a little cold. And I know a lot of my clients will be like, oh, there's that sticky gel mess again, but it's important.
And the treatment times range, it really depends on the applicator, but it's going to range from 35 minutes to 75 minutes, just depending on what size applicator you get. And like we mentioned earlier, we are treating 9 areas of the body, but it is all customizable. So we have all different shapes and sizes of applicators, and we can really customize it to what you're looking for and what your body type is. So like Michelle mentioned, we are doing 2 placements at one time. So we're going to be able to treat 2 areas of the body in 35 minutes, which is amazing.
That really cuts your time down.
I'll zoom in a little more here.
Yeah.
Sorry,
Let us
Mhm.
know, you guys, if you don't see anything, what we're doing, so I'll try and keep my head out of the way for everybody. So we're just gonna put the top one on, so it's just gonna suck it in like that. And then I'm gonna have you help me just turn this, I'm gonna have you go like that. So that's one on, and then I'm gonna just go around to the other side. Let's turn the machine on. How's that top one feel? Feels good. Kind of that section sucks on. That section sucks in. Okay. This one. Here. We're gonna be bikini ready. Yeah. She's like ready. Okay. Double fisted here. One on here. So that just goes on like that. So it's pretty easy. And it's just, she's feeling right now a little bit of a tugging feel. Perfect. And I'm just gonna strap you in right here. I'm gonna have you put your hand right here. So she's all ready, and we're gonna just turn it on, and I'll Velcro it in. So just gonna turn one on. So we're gonna have one on. She's gonna feel like a little bit of a hot, cold, tiny little bit of a stinging feeling for about 5 minutes. Once the 5 minutes hits, then it just, you go into that frozen stage. And you can see she's pretty relaxed. Yeah. We tranquilized her. but she's pretty good. And everybody does feel a different sensation. You know, for my experience, I was like, okay, that's really, really cold for the first 5 minutes. But the biggest thing is if I watched Netflix or just went on my phone, just kept myself busy, it's absolutely easy. So we're doing the abdomen area. Like she said, she wants to get ready for summer. She wants to be ready for, she's going to Hawaii. Jealous. And she just wants to, you know, feel her best and look her best in her swimsuit. So we're all hooked up here, and we'll come right back to you guys. It's our little studio, little process here. Okay, I'm gonna turn that other one on. And then do you have your phone? Yeah, you're good. Yeah, you can go on your phone. She's ready. Okay. Okay, let's move here. Perfect. We're back. Oh, I get my little free bag. Perfect.
Yeah, so like I mentioned earlier, the treatment times range from 35 minutes to 75 minutes, just depending on what area of the body that you're treating. And then, like Michelle mentioned, what to expect. So during the treatment, you're going to feel a little bit of a burning sensation, a little bit of a tugging. After about 8 to 10 minutes, you'll go completely numb and you won't feel anything. Most patients, as you see,
Yes.
on their phone, take a nap, watch a movie. So it's a really comfortable treatment. And then after the treatment, what you can expect is a little bit of inflammation, tenderness, soreness, redness, but all of that stuff is temporary and should go away within a week or two.
Yeah. We just got a little question, and it's from Susan, and Susan was wondering, will she be uneven because we've only put 2 spots on? No, she won't. This morning, actually, I kind of got ahead of everybody and I did the other side. So we will do one side and then we kind of rotate and then we do the other side. So she gets all that whole stomach area covered. It was a good question.
Yeah, and there's also no
Yeah.
minimum or maximum of
Yeah.
treatments you can do in a day. So it really just has to do with your schedule
Yeah.
and also, you know, what's available in the practice. Some
Yeah.
people literally come in on their lunch break and can go right back to work. So
Yeah.
that's really the beauty of the treatment. We start the treatment here, but then the whole process of freezing and killing your fat cells continues when you go home. So it's pretty amazing.
Yeah. So it takes like that 3 to 12 weeks for you to see results. I think most people kind of at 6 weeks will start seeing a little bit of a difference, but 12 weeks is kind of like your end. And everybody gets different results.
Mhm.
Everybody is completely different. Everybody's lymphatic system works differently. So it's like, you just gotta make sure, maintain your weight. Again, like diet and exercise, if you can do that, fabulous. If you can't, you still will get results. Again, it's a 20 to 25% reduction in the fat. You know, you want to like, you know, just maintain that weight.
And it's a
yeah.
permanent reduction. So
Yeah.
I think that's really huge because we have FDA clearance to say permanent reduction.
Yeah.
Because we are permanently killing the fat cells. So that's pretty amazing because it's a non-invasive treatment with little to no downtime that's going to permanently get rid of up to 25% of your fat cells with each treatment. So we can treat, you know, more of that sculpting patient, someone that is in good shape, like Michelle said, does Pilates every day, but just has those little sluggish areas. But we also can treat someone that's maybe just starting their weight loss journey and has a little bit more volume. And that would just, like I said, be customizable with your treatment plan. We'd make sure to really help guide you on what your desired results are.
And that gives you a great kickstart too, because it's kind of like you see it going away and it's like you're excited then and you're like, okay, I'm going to go to the gym. You know, you just get more confident in yourself. Cara asked, she had a C-section a year ago and she wanted to know how long does she wait? Do you want to take that one, Desiree? Yeah.
Oh, you want me to?
Yeah.
In terms of, I thought someone asked about the breastfeeding. So we have no data that talks about obviously doing the treatment while pregnant or, post-pregnancy, but we do recommend from a clinical side, typically, if you are breastfeeding, then not to do the treatment. I would wait till after. And then in terms of any scars, we can treat above it or below it. But if we treat over the scar, it's more of a scar tissue. It's not fat. And we're really targeted towards the fat. I think someone else did mention cellulite. So our main indication is for permanent fat reduction. So that is what the treatment is for. It's to get rid of the fat. If you see a little bit of skin laxity or a little bit of cellulite, there might be fat there, but for the best results, we're really looking for that pinchable, squishy fat.
Yeah. And, you know, I mean, you asked about the skin as well. You know, we have some slides and some of my clients, you know, it's like the skin, you know, it doesn't tighten the skin. It tightens under the chin. But again, I have you make sure you're doing your ab workout, keep it tight, you know, like just after your CoolSculpt if you can, make sure you're doing your abs. And also too, we do have, you know, there are certain creams too that you can use. We have Elastin here and I can talk about that in a little while for you guys. You know, in our before and afters, and this one is a lower and upper abdomen. This is 2 sessions. She got, and you can even see the little bit of elastic, you know, we don't Photoshop anything, so you can really see our clients. This is a good one. She just had a little extra volume. She had 2 treatments and she got great results. And you can even see like from this side, you can see how much volume it reduced. So she was so happy on that slide.
And so I think a couple people asked about the integrity of the skin. So like I mentioned before, obviously we're not, you know, a contraindication would be if you had a lot of skin laxity because the treatment indication is for fat reduction. But in terms of what's going to happen to the skin after the treatment, it's not going to create skin laxity. So if you had skin laxity there before, I always like to use the analogy of a balloon. If you have a blown up balloon and you poke a hole in it and then you deflate the air, it's going to be a little flimsy, a little lax. So if the skin's already lax and we take away a little bit of that fat, it could make it look more lax. But if the skin's taut, tight, nice, there's pinchable tissue, it's not going to create skin laxity.
Yeah. And, you know, and even like, you know, the flanks, people say, what about on the back? Do you get loose skin on the back area? You know, I have treated so many people and I really haven't seen anything, which is amazing, you know, with looseness on the back or anything. This client, she had her flanks done. So her flanks are like that back area. It's kind of like your love handles, but kind of around the back area. A lot of us kind of get that back flanks, you know, hormones is a big thing, you know, when you kind of gain that little extra bit of fat and you're like, where's this coming from? You know, so that back flank is a really nice area and you can treat like the entire area of the back, which is fabulous. And you do get really, really good results.
I think a call out, am I going back one?
Yeah, we'll go back to the flank.
I think a call out for this one, which is really amazing, is you can notice the asymmetry on this patient. And one of the beautiful things about CoolSculpting is we can fix that.
Mm-hmm.
It's totally normal to have more volume on one side of
Yeah.
your body. And so that, again, back to the customization part, where it's not one size fits all. If you literally just want to work on the right side of your body to even out stuff, we can really do that and create that nice symmetry with CoolSculpting.
Because a lot of time we just lean to the left, and it's like you're just like, okay, what's happening? I'm more volume on that side. So again, Desiree said we can totally fix it. This is like one of my really favorite clients, and she was getting ready for her daughter's wedding, and she had this beautiful dress that she wanted to fit into, and she came in and she got beautiful results and was so happy and looked amazing for her daughter's wedding. This was beautiful. Okay, do you want to do that one?
Yeah, this is another one. So this would fall into the category of that sculpting patient, right? They had really nice definition, not a lot of volume, but they still wanted to get rid of those sluggish areas of tissue. So even with this patient, they didn't have a lot of volume, but they got really good results with 2, where pretty much all the volume is gone, which is always the goal, right?
Yeah, and this model was actually, this is Liz's picture. And yeah, I mean, I don't even know how I recognize Liz, but this is her stomach. This shows you I CoolSculpt too much. I now know people's stomachs. But Liz, actually, this is when we did this, like, this is probably she came in and Liz had hurt her back for a long time. She was in a lot of pain with her back and she couldn't work out. And she just gained a little extra volume in her stomach, and we CoolSculpted Liz, and amazing results. And this, and she couldn't work out. So like I go back, if you can't work out, it's not it's not like, oh, I can't work out and I can't CoolSculpt. You can. So again, that was 2 sessions to her lower abdomen. We try to, like, when you come in, it's, one session, obviously you're going to get that 20-25%, but 2 sessions, you're like, oh my God, I'm really seeing great results.
And someone asked about the tattoos in the abdomen.
Yeah.
We can treat over tattoos. We always want to make sure that we actually start with a tattoo area, just in case sometimes the ink, especially if they're older tattoos, there could be metal in the ink and it can cause an error code on the applicator. So we'll make sure to treat over the tattoos first to make sure that we can treat over the rest of the body, but it's definitely not a hard stop if you have them.
And the funny thing is that I actually ran into that, and the black tattoos, like the less color, seemed to work great. And then I just had one, it was like a very, very bright pink tattoo. And it couldn't pick up on the tattoo. So, but that's a great question.
Wow, this one is amazing.
Yeah.
I'm just staring at it.
Yeah.
So
Yeah.
this is what we would call our more of our devolumizing and sculpting patient. They did have that volume that's leaning over their waistline. So you're really able to get in there, not only take away that volume, but then go back and after and refine it and give a nice sculpt. And with this patient, I mean, if they really wanted to get the sculpt, they could probably have one more session just to tie it all together.
And she was amazing. And honestly, I know with the skin and everything, where you can see she had a little bit of lax in her skin. But I really do think the skin looks so much better.
That's
and
amazing.
She did everything. And I think we might have the picture of her sideways, but really, really, really good results. Lower and upper abdomen. And then she came back and we actually started working on the back area. And I love this.
Someone had a question about stretch marks. So do you have any call outs for that or anything that you've seen with the treatment?
Yeah, no, it is that, I think she was worried in case the stretch marks darkened. No, we all have stretch marks. They're all like hidden somewhere, but I've never had somebody that it's darkened the stretch marks. So if that helps you. Yeah, absolutely. And sideways here, you can see the reduction of the client, because it's like in your mind you're like, oh, I can't even imagine the reduction, but that is an amazing reduction on this side. Yeah,
it's beautiful.
Yeah. This is cute because this is my client that actually came to visit her daughter, and she came from somewhere cold and loved California and decided like, I need to do some cool sculpting when she arrived. So this is just, she did her flanks, and we're still we're working on other little areas for this client. Oh, there she is again.
Wow.
That was it. So you
Look
can
at
tell,
this.
yeah, this is the where she had her, she had no tan, and then she came back to me, she was so dark. But we used her flanks and rolls. It was like the back area, that was like 3 sessions on her back area, but look how nice and smooth her back is now.
Mhm, beautiful.
Yeah, I like
So
the brow.
amazing. Yeah, so this is someone was asking earlier about the saddle bag. So this is an example of the saddle bags, like some people that have that true saddle bag. A lot of the times it's genetic.
Yeah.
People are like, the rest of my body's toned. How do I get rid of the tissue in that area? And so we do have a flat panel applicator that just wraps around the side of your leg so it can contour the leg. And it's really, really
Yeah.
beautiful for shaving down that volume on the side.
And again, another question is, do you recommend, how many sessions would you recommend when you're doing outer thigh? And, and it depends on the person.
Yeah.
It really does. And that's why it is really important if you just come in, have a consultation. You don't even have to come in. If you want to call me, we'll do a virtual consult. And, it's funny because I've done quite a few virtual consults, and my last one was in the supermarket in the freezer section. So
Not her, the patient.
the patient. So I thought it was cute. So yes, if you can't, absolutely come on in. We'll do virtual, or we'll do it in person. Nikki, no problem. Nice that you're joining us. We're happy to have you. Banana roll, and that's our little hammock area right behind you, behind your butt.
That's the area that
Yeah.
no one knew was an area, but the people that have it know it's an area. So it's that little taper underneath the glue. And with this, what I've noticed, I've seen it on a lot of petite patients, and it really can have a big impact if you are a true candidate with it. It can give you the illusion of a nice lift because it'll smooth down and press down the skin underneath the buttocks. So it's a really, really beautiful treatment.
Because when you're wearing your jeans or and sometimes you kind of go, God, what's that little extra thing at the back of my jeans? That's your banana. So that area, and it's such an easy area. It's like 35 minutes. You come in, lay on your stomach for 35 minutes, watch a little bit of Netflix, and you're out the door. There's little to no downtime. It's that's a great lunchtime one. That's like a pop in and get that one done. Oh, the jowl.
My personal thing.
Yeah. Ray loves the jowl.
So with this area, we call this the submental, but also it can be the whole jaw area. This area is actually cleared for permanent fat reduction and the appearance of skin laxity improvement. So this is the only area that's cleared for both, which is amazing. And as you can see on this patient, she had a lot of volume and absolutely no contour. And with just a couple sessions, we're able to really give her that nice facial contour. The reason I love this is because if someone's just starting their weight loss journey, a lot of times they're like, okay, I want to lose a little bit, or it seems so overwhelming. So if we can start with a big impact and really have them see it in their face, then it will get them excited and want to move down the rest of their body. But this treatment is so amazing. And as picture says it all. It's a really, really impactful treatment.
The chin, when you have that little extra underneath your chin, it really does change your whole appearance. And and also to just to cool with the jowl area, you have to be that right specific candidate for the jowl. I do get people that come in and they just may have just the tiny little bit underneath their jowl area. Hey, if the CoolSculpt doesn't work for you, we have so many providers here that will do Kybella. Kybella again eats the fat, and if you just that tiny little bit, they can take care of that, which is amazing. And then we have somebody, if you want to really sculpt your jawline, we have so many other providers that will do fillers in the side of your chin and give you that nice sculpted chin as well, if you're not a suitable candidate. But with the CoolSculpt, you're in and out.
Yeah, and the great thing about it, people ask all the time, what is my face? What's the downtime?
Yeah.
It's my face. I don't have time to go back to work.
Yeah.
And that's the beautiful thing about this treatment. It might be a little red after, it'll definitely be a little
Yeah.
sore, a little numb.
Yeah.
But in terms of inflammation or, being able to know that you even had a treatment, it'll go away in like a couple hours.
Yeah,
So
people don't notice.
yeah, they do not notice. And then all of a
Yeah.
sudden they'll look in the mirror 2 weeks later, 3
Yeah.
weeks later, and they're like, oh,
Yeah.
it really works. So
Yeah.
these are really, really amazing.
Yeah, I love when somebody comes back in, because I'll have some clients and they'll go, I don't see anything. And that's like 2 days later. And then it's a week, and then it's 4 weeks, but the 6 weeks they're like, oh, shall we see it? So that's when you get excited. And really, it's like you can walk out the door and people really, unless I leave that marker on your face, that's the only way people are going to notice you've had anything done. So that's a good one. Oh, this is the little bra fat one. And this is like, that's those Lululemon bra tops. You put them on and that little area pops out. This is a really good area. If people sometimes people think they can't treat that area. That area makes a huge difference, especially if you're wearing a cute cocktail dress or something. You can really, really take care of that little area. We use a smaller size applicator and it's called the Mini. And it just fits in that spot absolutely perfect. There's one of my clients. I noticed that arm.
Yeah, so this
Yeah.
is our upper arm, and this one is, I mean, it's not new, but it's the newest clearance that we have. We saw that so many practices, their patients were in love with this treatment. So we did, spend the extra time to get this area cleared by the FDA. It is amazing. It really, really helps with the bat wings. People
Yeah.
always come in and they're just like pinching their arm. They're like, oh, I have this. So it's really nice to be able to have a treatment that can help address, a concern that a lot of people have.
Yeah, but the arms, and what I really, really like is that when we stretch out our arms, sometimes we might have a longer arm and you need we have an area where we can just put the two areas on your arm now, which is really, really nice. You all have different size arms. Again, I really honestly treat the arms twice. You will absolutely love it. If you need that third treatment, go for the third treatment. You'll get phenomenal results. Somebody just said, is there a price difference when using the Mini versus the larger pads? No. No, absolutely. Everything will be still the same price. Are both arms included in one session? We hope. We hope.
Unless you're asymmetrical.
Right. We also too, just to let you guys know, we do have financing options. You can treat now and pay later with Cherry. Cherry is an awesome program. You can choose a 3, 6, or 12 or 18, or even a 24-month payment plan. So again, we can, when you call in, I can explain everything if you need any financing options for CoolSculpting. Should we check in on Lotus? Have we forgotten about her? So we're just going to check in and make sure that you're doing okay. So seems happy and everything. How are you feeling?
I feel good. I don't really feel anything.
You're pretty numb right now.
Yeah.
Yeah, so she's in that numbness stage, so it's amazing. You can see how comfortable she feels. I know we'll just get you guys so you don't see my head. And then she has 12 minutes left, which is great. So the time goes super, super quick. She's comfortable, and we've treated one side already, so now we're on the second side. Again, we have a Radiance membership, and you can experience savings all year long, up to 50% off CoolSculpting, 20% off Morpheus and laser facials. And we always do so many virtual events about Morpheus. You can learn about Morpheus. We've exclusive Botox pricing. Our pricing is amazing. $50 off each syringe of filler and more. You can also they can sign up with revive.md or in-store doc. And we can, if you want to text in, I can give you all that information again. Tamara said she can't wait. Oh, this is our lovely manager right here, and she's doing her chin, Karina. If you guys have, please, any questions, we will get right back to you. If I haven't gotten back to you today, I will absolutely get back to you tomorrow. And then
the treatments. Yeah. So we're actually doing 2 treatments. Placements, treatments right now. And there's really no minimum or maximum of how much we can do in a day. We can do up to 4 at
Yeah.
one time. So it really cuts your time in half.
Oh, it's great. And Brianne said the Radiance membership is so worth it. It is a great membership. It really is. But so do we have any more? Will we answer some questions? Everybody, just any questions you have, absolutely just send it in. Again, somebody asked, what are the areas? There are 9 areas of the body. There's the under the chin, there's the arms, there's the little area, your little bra fat in front, your abdomen area, that would be your upper and lower, your love handles, your back flanks, inner and outer thigh area. Oh, and we left out an important one, above your knee.
Distal thigh.
That little distal thigh, you know, you can absolutely take care of that. What is the number to you? We will send you that. We'll send you that number, Karen. Yeah. Oh, I had a in-person consult a year ago. Do I need another? Lori, absolutely. You can just call in, and we have you on file and everything. You won't need to. And I can give you a call back as well if you need to tell me what areas you want me to treat for you. The number of the Revive Med Spa is 619-293-7233. Again, 619-293-7233. And we're on the website as well if you want to look anything up about Revive. Your questions are fabulous. We love these questions. Lotus has like 8 minutes left, and we'll take the applicators off, and if you want to hang out, you can see the end of the process. Again, can we answer more questions for them? What do you think, Desiree? What area would you, somebody said, what area would you pick if you wanted to treat?
I mean, our most common areas of treatment are the midsection. So the whole abdomen and the whole back. That's about 80% of our, of the patients that come in. But, you know, I'm starting to see once you do that, people love it. They love the results. And so they organically want to go to other areas of their body. So it's pretty nice because you might have had a treatment a year ago in your abdomen, and then now you're ready to treat your flanks or your inner thighs. So I think people love it. I mean, we've been around for a long time. We've done over 14 million treatments. So, you know, the proof is in the numbers, and the patients really, really love the results of the treatment.
And, you know, the amazing thing, and I've worked with most of the CoolSculpting machines, we actually have the elite machines, and the elite machines are amazing. And, you know, when they improve technology, you want to go with the best technology. I find, you know, treating CoolSculpting over the years, they fit the body better. I feel like my clients get the results a little, you know, quicker. They're an amazing upgrade to the machine. Do you like the Elite since they came out?
Oh yeah.
Yeah. Yeah.
Right.
Right.
We've
Right.
both been around for it all. So all the generations.
Yeah.
But the biggest thing is we're really committed to patient results. That's the number one thing. And the biggest thing with the Elite is patient comfortability. That's the thing that I've noticed the most.
Oh,
is
yeah.
People are like, I can't even feel it compared to maybe older ones that are a little bit more uncomfortable.
Yeah.
But the results are there. The science is there, and we're the only ones that are really doing it in this space for non-invasive fat reduction. So that's pretty amazing.
You know, when people when they're asking questions about CoolSculpting, I kind of put it like, when you gain weight, your fat cells expand. When you lose weight, they shrink down. But when you CoolSculpt, you're actually killing those cells. And there's a lot of different things out there, you know, that people are losing weight with. But you know, we can marry the two things together. We can, like, you know, if you're losing weight, you come see me, because you know what, those fat cells are still alive. So where with the CoolSculpting, we're actually killing the fat cells. So we're permanently getting them rid out of your body. I feel like they have little white flags and they're all leaving your body. So it's like, that's a really, really nice area. And, you know, I get a lot of clients that come in and they've had, like, hysterectomies, and, you know, all of a sudden your fat is just coming out of nowhere. Your hormones are going crazy. CoolSculpting really does get rid of that area. People that have had babies, you know, you have that C-section scar, and you get that little lift over the abdomen area. It's a great way to CoolSculpt, just to get rid of that little shelf area as well.
Someone did ask, how long do the consults typically take?
The consult's like 15 to 30 minutes, just, I don't want to take too much of your time, but like at least 15 minutes would be fantastic. We've got like, I'm just gonna get that question right there. So with my 4 pregnancies, I've fluctuated weight a lot, but now under my chin, this is still bothering me, but I felt like a combination of loose skin due to the fluctuation of some fat, if any solution for that. So you're kind of basically saying that you have a little bit of the looser skin or underneath the chin. Yeah, we have we have different things that you could come in and try out, but your best thing is to have a consultation so we can kind of see that area, and then I'd be able to give you the right solution to that. That was a nice question. We'll check in. We have 4 minutes left. And again, we hope that you liked our little presentation, and we love CoolSculpting here at Revive. And we'll just come over to Lotus and we will check in on her. I'm gonna just read. Oh, we'll keep to 2 minutes over here. Does that have great? Okay. And then again, if you're just joining, this is Lotus, and we're a little wave, and we're CoolSculpting her upper and lower abdomen. So I've already started this morning. We were in here nice, bright and early, and we sculpted one side. So somebody had asked me, is she going to be uneven? But we've already started. So we have one applicator here and one applicator on the bottom, and then we're just going to flip flop, and we're treating that side. Lotus is off on vacation, and she's going to Hawaii, just in case you guys missed that. She's an active mom of 2, so she's always running around after 2 kids. And like the little ding right there tells me she's got a minute left. This is like the countdown to the Super Bowl. So we're gonna take it off. Now, what should she expect when it comes off? She'll expect like a little bit of a kind of a cold, little hot feeling. I always tell people it's like a little piece of ice and you put it on your leg, and it kind of you still have that numbness, but it actually feels hot. She's gonna feel that. So we're going to massage the area. Sometimes the fat cells can escape and get onto the border. So that's why we massage that area, and we just kind of kill those little escape fat cells. And I'll feel the crystals and just massage it out so she's nice and smooth. And then she can do everything. She can go back to work. She can work out. There's absolutely no downtime with her CoolSculpting. How do you feel it? Yeah, we're just all watching you here. Yeah, it's like the countdown. She's like the final countdown, and she's so relaxed and everything. So again, any consultations, please give us a call, and we'll answer any questions for you. And I see everybody with piles of questions, and I will get back to you guys and answer all the questions for you. I'll have Desiree. Do you want to do the one side and I'll do this side? We can. Do you want some thoughts? And I'll come over to this side and we'll take it off. Perfect. And then Liz can kind of come in a little closer for us so you guys can see everything. Bring you guys right in here. Just in strap. Perfect. So I'm going to take this one off for her. That's a little bit, that's 54 seconds on that one. So we're just going to pull it off like that. Okay. And then we'll pull it up, and you'll see it's a little red. And then we're just going to massage that area. So right now I'm just feeling how cold it is, and just going to massage and kill those fat cells for a little bit. Perfect. And the other side has 30 seconds, so we'll take that off, and we'll be able to see the other side as well. How are you feeling there? What are you feeling right now?
It's a little tingly, but other than that, all good.
So we will exact same side, So we hope you enjoyed our presentation today. And then we will post results once Lotus gets to her 6 weeks, and we'll give you guys updates on her whole journey. Thank you for joining us. And we hope to see you guys next at our next virtual. And fingers crossed, whoever's going to win. And I hope to see you guys again. Thank you for tuning in.